Hi, I'm Dr. Ron Miller with Pursuit Physical Therapy, and today we're going to answer the question, what should you do if you still have low back pain after a fusion? Okay, so the first step is definitely do not do any more surgery. Okay, that's the last result of what you should do. Okay, so part of it is you can't fix the areas that are fused already. They're fixed. They have screws or rods in them. So that part of the lumbar spine or the low back is fused. There's nothing that we can really do about that, but there is hope still. Okay, you can take a look at the joints above the fusion and the joints below the fusion and solve some impairments around these areas and see if you treat those, can you deload the spine? Okay, a perfect example is this. Can you return to golf after having a low back fusion? Many people will say no. Many people will say don't even think about picking a club until a year later. But I would say yes. The key isn't to just go back to your old habits and having old flaws to overload the back. There's two things that you have to really do to be able to get back to golf after having a fusion. One is address all impairments in the hips, pelvis, and the thoracic spine to deload the low back so you're not overloading a fused or a fixed lumbar vertebrae. And the second one is do swing modifications. Adjust your swings to create less torque across your back. So there's many different ways to go about treating this. And again, the point is you need a thorough evaluation to look at the big picture here. What's happening above the fusion? What's happening below it? Is there some sort of risk factor that was missed that's still causing the low back pain to occur even after you have a fusion? So many times, at least 60% of cases who have a fusion, have failed injections, can still come and get therapy and still get at least a 50% reduction in pain and get back to walking a mile, get back to golf, and get back to shopping and stuff like that without having flare-ups of back pain. So if you've had a lumbar fusion, you're still suffering with back pain, the first step is really get a thorough eval and solve the root cause of why. And we can definitely help with this, and we've seen many cases of people who have low back pain after this and they get a successful outcome. If you're tired of your back pain, you're ready to get back to doing your favorite things, and you're still suffering from back pain after a fusion surgery, give us a call at 407-494-8835. We can get you in for a thorough assessment. We'll make sure that you're taken care of, and we'll customize your treatment program to make sure that we solve the root cause. We'll identify the risk factors, and we'll get you back to doing your favorite things. So if you have more questions or you have questions about our treatment approach, you can visit us at pursuittherapy.com, and we hope you learned something from this, and thanks for tuning in.